Well, unfortunately, the answer is yes and no. Today, I was able to talk to the director of analytics here at OHSU. He's the one with tasked to come up with these projections and see which direction the state is going in. He says it's because hospitals made the tough decision to put on standby those non-emergent surgeries that they do have the beds currently, but they are at capacity. However, he says this causes more problems down the road.
You can get his arm under his hip a little.
For hospitals, the situation today is as bad as it's ever been.
Our system followed a path to a very bad place. The statewide census in the state, if you add up all the COVID patients across all the hospitals, is almost 1,200 patients.
That is the highest number Oregon has seen through this entire pandemic. Thursday, OHSU's Director of Advanced Analytics, Dr. Peter Graven, released his latest projections. And while things don't look good, there are some hopeful signs.
In fact, in Oregon, we are. In fact, the last three weeks, we're seeing week-over-week increases in vaccination.
Which Dr. Graven says protocol changes we have seen, like mask wearing indoors and outdoors, is contributing to a slow but positive change in trends.
I am seeing some signs that this is going to level out in this next week.
He says we are at a pivotal moment, meaning that we can flatten this out or potentially lose progress, which is why he says some changes, like kids heading back to school, is something we should keep an eye on.
I think the next thing that I'm really worried about is that potential surge. We believe if you take strong action and protect yourself at school, that the transmission risk can be low.
He says with this year being full-time and 5 days a week, there is still a lot of data we don't have, which is why he says it's more important than ever that we all, and especially kids, follow protocols.
It doesn't hurt to be extra cautious right now. If you end up with kids getting sick at really high rates, we really don't have a lot of room for pediatric ICU space in the state.
So again, these next few weeks could be the game changer, which means we all need to continue those precautions of mask wearing and social distancing. Dr. Graven also tells me it's likely these precautions will have to remain in effect through October.
Yeah, Catherine, and some are choosing to do just that. I talked with a handful of people who are going to lay low this weekend, and that is mostly over COVID concerns. But as you mentioned, doctors are also concerned about those unpredictable cases, heart attacks and broken legs, as you just heard. Hospitals are already at capacity.
As an emergency provider in the greater Portland area, it is normal for us to see an influx of folks on any holiday weekend.
Emergency physicians like Dr. Alex Skog are used to seeing a spike in patients during long weekends.
Frequently, that's because a lot of other venues for receiving medical care are closed, and also people are out enjoying themselves.
The extra day off gives people more time to relax or to take risks.
That, for better or worse, naturally leads at times to people requiring medical services.
That's the worry, as hospitals in Oregon are already reaching capacity. In an open letter, hundreds of doctors with the Oregon chapter of the American College of Emergency Physicians asked people to limit what they do this Labor Day weekend. Keep gatherings small and outdoors, wear face coverings, and avoid dangerous situations.
If by getting the word out there and we can convince, let's say, 20 Oregonians to be less likely to take on risky activities this weekend, either with regards to COVID or with other possible things like trauma, that can make an enormous difference in our wait times in our emergency department.
In addition to making smart choices, these doctors are urging people to get vaccinated. Coming up at 6 o'clock, we asked people here in Portland if they're changing their Labor Day plans. We'll let you know what they said coming up in an hour. Yeah, Deb, the new rule at Autzen is those people who are 12 and older, if they want to go to the game, well, they're going to need to either show proof of vaccination or a negative test result. That means that people are likely flooding to local urgent cares trying to get their hands on those tests, but it's putting a strain on those resources.
We are seeing more people who have a confirmed exposure. We're seeing more people who have COVID symptoms.
In the midst of Oregon's worst COVID-19 spike, not only are people needing tests to see if they've been infected, but also they're needing tests just to go to certain events. More and more venues are now requiring proof of vaccine or a negative COVID test for entry. Between the two, it's hard for local testing centers to keep up. OHA saying that health systems are struggling to meet the testing demand, adding, quote, supply chain limitations, laboratory staffing limitations, and competing vaccine resources to operate testing sites are all contributing to this strain.
We do have an abundance of kits.
Dr. Andrew Miller, the chief medical officer with AFC Urgent Care in Portland, telling me they have the supply, but getting an appointment is challenging.
We are trying to fit everybody in. As I look today, our website is filled for appointments, but if patients call AFC directly, we can usually find a clinic that has a little extra capacity to fit those last couple of patients in.
OHA continues to push vaccination, which would then avoid the need for certain tests for more frivolous things like sports games and concerts, warning, quote, the state and our healthcare system do not have the resources to support widespread screening of unvaccinated individuals.
Another hurdle for people needing those tests before they go to certain events, they'll likely have to pay. OHA telling me if you have health insurance, testing should be free if you have symptoms or known exposure. For travel or for employment or for events testing, the cost will vary.
Deb, the union lawyers say state law prevents the city from doing this. In addition to members of the police bureau, the PPA also represents emergency dispatchers. The union lawyer says the city can't force vaccinations unless it is federal or state law. The PPA says the police bureau and dispatch center are already dealing with a staffing crisis that will be made worse by this. That email, in part, reads, we also know that many first responders are deeply opposed to vaccine mandates, so deeply that some will leave the profession before accepting a mandate. The city's desire to mandate vaccinations for police and dispatch will ultimately exacerbate an already dangerous staffing crisis in PPB and BOEC. It goes on to say the PPA is committed to encouraging its members to make informed decisions to protect their health and safety. Quote, the PPA believes this is something we can accomplish not through mandates, but with communication and respect for the various beliefs and interests of our diverse workforce. That's an email we got through an open records request between the union and the city. The Portland Firefighters Association, a union representing PPB's command staff, and the union representing about 900 other city employees each filed a demand to bargain this new vaccine mandate. We have reached out to city leaders to see how this will impact the implementation of that mandate. We'll let you know if we hear back. Deb?